Why looking younger is not the same as looking different. Why looking younger is not the same as looking different. Most patients ask for one thing. They want to look younger. But somewhere along the way, aesthetic medicine started confusing younger with different. And this may be the biggest mistake in modern aesthetics. The purpose of rejuvenation is not to create a new face. It is to restore features that have been lost through aging. The best treatments often leave friends saying you look well rested or refreshed, not asking what procedure you had done. Rejuvenation attempts to restore youthful proportions. Beautification attempts to create new proportions. Neither approach is necessarily wrong. But problems occur when patients seeking rejuvenation receive beautification instead. Human faces are remarkably individual. We recognize family and friends through subtle anatomical features. The eyes, nose, lips, chin and facial proportions all contribute to identity. When these features change excessively, the face may look unfamiliar despite looking younger. One of the commonest mistakes in aesthetics is assuming that aging equals volume loss. But aging is much more complex. Excess volume can make faces appear wider, heavier and less defined. The result is often a face that looks treated rather than youthful. Beauty standards evolve over time. Large lips, exaggerated cheeks and sharp jawlines may be fashionable today. But trends come and go. Natural facial proportions usually age better than temporary aesthetic trends. Social media filters have dramatically changed how people see themselves. Patients compare themselves with edited images rather than real faces. This can create unrealistic expectations. And sometimes normal anatomy starts to look abnormal. A beautiful face is rarely defined by a single feature. It is the relationship between features that creates harmony. Adding volume to one area without considering the whole face can disrupt these proportions. Good aesthetics is about balance rather than enlargement. The goals of treatment change throughout life. A patient in their 30s may seek prevention. A patient in their 60s may seek restoration. The treatment plan should reflect the patient's anatomy, age and goals rather than current trends. Patients occasionally request treatments that may not improve their appearance. Good injectors understand that technical ability alone is not enough. Professional judgment is equally important. Sometimes protecting the patient's appearance means declining treatment. The most successful treatments often attract very little attention. Patients simply appear healthier, fresher and less tired. Their identity remains unchanged. Many of the best aesthetic treatments are the ones nobody notices. The goal of modern aesthetics should not be transformation. It should be preservation. Looking younger should not mean becoming someone else. And preserving identity may be the highest form of aesthetic medicine. Creating natural outcomes requires more than learning injection techniques. It requires understanding anatomy, aging and facial proportions. These are exactly the principles explored in Anatomy for Injectors and the Cadaver Dissection Workshop for Injectors. Because great aesthetics begins with understanding what should be preserved. If you enjoy evidence-based education in anatomy, injectables and aesthetic medicine, subscribe to Dr. Ben Chan at ASI. Thank you for watching and I will see you in the next video.